The standing position causes lower back pain in a lot of people, and activities that involve standing, like walking and certain exercises, can irritate the lumbar spine even more. By the end of this video, you're going to understand exactly why standing causes and aggravates problems like stenosis. You're going to see an animation of exactly what's going on with the lumbar spine. You're also going to learn why sitting, even though it may be more comfortable, is a contributing factor of this problem. We'll also talk about a specific type of exercises that is highly likely to irritate your lower back and should be avoided temporarily. And we're going to talk about a short-term strategy which you can use to be able to do certain movements and activities that can lessen this irritation to your lumbar spine, and a long-term strategy that directly addresses this root cause and can get your body into a condition where it can tolerate standing and walking and all the different types of exercises without getting lower back pain. So let's get right into it. This is a side view of a person facing to the right. This is their lumbar spine, L1, 2, 3, 4, and 5 behind the pelvis there. Here's the pelvis, sacrum, and tailbone, and the femur. And the muscle that you see here is the psoas muscle. This is one of the major muscles in the hip flexor muscle group and is one of the main contributing causes of this problem. So we're actually going to start off with this person in a sitting position to help explain what's going on. The psoas muscle attaches directly to each vertebrae of your lumbar spine, and it comes down and it connects into the femur, which helps to lift your leg when you're flexing your hip, which is why it's called a hip flexor. And when you're walking or marching, going upstairs, it is lifting your leg. And when you're sitting, the psoas muscle is in a shortened position. It's like it's already contracted, but it's just resting, sitting there in this shortened position. And when you go to stand up, the hip flexor becomes in a more lengthened position. But the problem is when we are spending a lot of our life in this sitting position, the psoas muscle becomes adapted to this shortened position. And then we go to stand up and it doesn't want to fully lengthen. And the thing that happens when the muscle doesn't fully lengthen is the lumbar spine gets yanked on, it gets tugged on, and it kind of collapses forward into what we call hyperlordosis. So if you watch the lumbar spine here, it's going to get pulled forward as the leg comes down. And that's because the distance between the femur and the spine is increasing. This increase in distance requires the muscle to lengthen. However, if the muscle is not lengthening all the way, it's going to pull on its attachments, just like tension in a rope. And so if the lumbar spine is not very stable, not very supported, this yanking on the lumbar spine pulls the vertebrae forward because this is a very strong, tense muscle, and it has the ability to do that. These are small joints here. So I want you to look at the space between the vertebrae as this shift in the spine occurs. Now we're in the sitting position, the tension is off of the lumbar spine. That psoas muscle is not pulling forward on the lumbar spine, and we have pretty nice spaces, specifically looking towards the back of the vertebrae in this space right here. And as we go to stand up, that space gets decreased. Now we see that the vertebrae are almost touching in the back here. Well, these spaces here are where nerves and blood vessels exit the spine. And if there's less space here, it's more likely that something like a nerve can get compressed, and that would cause lower back pain. It's also going to compress the discs in the back, which are not pictured here, but you can imagine that the intervertebral discs, when they get compressed so much in a certain area, they're going to start bulging into the space in the canal behind the vertebrae. And that's what we call a disc bulge. If that happens enough, then we would call that a herniation. So as we add this muscle back in the picture, you can see how it kind of causes a bowing effect in the lumbar spine. So I mentioned that sitting can be a relieving position. And that's because sitting is taking the tension off of those vertebrae and allowing them to sit in a more neutral position. However, as you can imagine, sitting is a contributing factor causing this problem. It's the reason why the psoas muscle gets accustomed to this position and starts to adapt to being in this shortened position. And losing its elasticity, its ability to fully lengthen and allow the hips to open up, without compromising the lumbar spine. So we're going to take a look at the pelvis now, because the pelvis plays a role here too. The pelvis in a sitting position is in a relatively neutral to posterior tilted position. And when we go to stand up and this problem occurs, the pelvis rotates forward. And that's primarily because of a muscle called the iliacus muscle. So the psoas is not the only culprit in this problem. The iliacus attaches to the inside of the pelvis and then actually joins in with the psoas to attach into the hip in the same spot. Together, we call this the iliopsoas. And so the rotation of the pelvis is another contributing factor to this bowing effect, because the pelvis and the sacrum are the foundation that the lumbar spine sits on. So when it tips forward, you can see now that the L5 vertebrae is actually tipping forward with it. And all of these factors are why sitting is not an ideal thing to be doing too often, and going into a standing position after you've been sitting for a long time can compromise the lumbar spine. Now, it probably makes sense that if we add the walking motion to this posture, that it's going to add friction into these joints, causing even more irritation and wear and tear on the spine when they're sitting in an incongruent position like this. It's as if the lumbar spine is always in a backward bending position. And when you're standing, that your spine is basically living in a backward bent or extended position. So that brings me to the specific types of exercises that a spine in this position would not be able to tolerate very well. And it would make sense that if the spine is already in a backward bending position, that exercises that involve backward bending would compromise the spine even more. So exercises like the Cobra or the Superman or certain yoga poses, or even a lot of overhead activities can force the lumbar spine into a further backward bent position. And you may have noticed that reaching overhead for long periods of time can irritate your back even more. So if you're a person that has anterior pelvic tilt or hyperlordosis, it would benefit you to avoid all types of exercises that involve backward bending, at least for a short period of time, while you work on a long-term strategy to correct this condition. But there are still things you need to be able to do in your normal daily life that involve small amounts of backward bending. And that's why I want to show you this short-term strategy that can allow you to do these things while protecting your spine. So for example, things like looking up towards the sky, looking at a tall building or a bird, or drinking the end of a glass of water, or reaching for certain things, they are going to involve micro movements of backward bending in your lumbar spine that can cause irritation. So a short-term strategy you can use to be able to do these things and protect your spine while doing them is to squeeze your glutes. The glutes are your powerful buttocks muscles, and they can posterior tilt your pelvis and open up your spine a little bit in the back, allowing you to look up or reach up without cranking on your lumbar spine and causing more irritation. So squeezing your glutes, if you don't already know how to do that, you can just imagine cracking a walnut between your butt cheeks, and that is a great strategy for the short term. Now, the long-term strategy for solving this problem involves understanding that the muscles we've been talking about today do not operate in a vacuum. In fact, no muscle in the body operates alone. Every muscle is part of a muscle group, and the different muscle groups interact with each other, and that's how the body works synergistically. And so this tight muscle here is actually part of a much larger muscle imbalance that we need to correct in order to let the spine sit in a more neutral posture. And so now we need to start talking about muscle groups like the abdominals, the hips, the pelvic muscles, the lower back muscles, and all of these muscles need to be in a length tension relationship with each other that just naturally hold the spine in a healthier position at rest. And this is going to involve getting more tone in most likely the abdominal muscles and the hip extensors, and reducing the tone in the lower back muscles and the hip flexors. This whole region of the body is the lumbopelvic hip complex. All of these muscle groups are so interconnected that it's not just as simple as stretch this muscle here and strengthen that muscle there, but I do want you to understand that it's important to bring more tone into certain muscle groups and to reduce the tone in other muscle groups, because these hypertonic or overly tight muscle groups are compensating for weaknesses elsewhere. And we call this muscle imbalances. And so in order to address this problem in the long term, you want to restore balance in the muscles in your body. And the best thing you can start doing today to start reversing this problem is to sit less and get up and start walking around more in your daily life. And if walking hurts, then then you'll probably need to get down on the floor and start doing some core engagement exercises using the floor for alignment. Now, this is a process, and there's not one single exercise that I could tell you that's going to solve all your problems, but an exercise like the bridge can be very helpful if you do it the right way. The bridge is such a valuable exercise, but the problem is that it is most often done in a way that can actually make this problem worse. And in order to do it the right way, I would encourage you to seek out some professional guidance before jumping into an exercise that is what I consider to be a complex movement, especially with the lumbar spine, like the bridge. And if you're not sure where to go, we do offer a free trial of core balance training that takes you through 7 days of teaching you how to do the perfect bridge. And also the entire purpose of this program is to restore balance in your body, to address problems like stenosis, so you can get back to doing all the things in your daily life that you want to do without hurting your spine. I'll be back next week to talk about a different topic related to getting out of the back pain cycle for good. And until then, get down on that floor and connect to your core.